There's a lot of people dying now than normal. There's more people dying now than normal. In the UK, 1,300 more people a week are dying than normal, and they don't know why. Now, you know what the conspiracy theorists are saying. I don't think I can say it on this channel. But keep in mind, as far as COVID goes, I think the conspiracy theorists are about 5-0. And the people who have been lying have been Fauci and the government and the corporate media. It's captured by Big Pharma. So the liars here have been the usual suspects, the people in government, the people in corporations, and the people surrounding all that money. Non-COVID excess deaths, why are they rising? So I'm going to play a little bit of John Campbell. You know me, I like this guy, Dr. John Campbell. And he taught nurses how to be nurses for his whole life. And so this guy knows a lot about a lot. And here's what he says.
Well, welcome to today's talk, Wednesday, the 6th of July. We're looking at excess mortality. Now, basically, there's about 1,300 too many people per week dying in England and Wales at the moment, and we don't know why. It is not COVID-related. People are dying much more than we would expect based on previous year's averages. And I'm going to be giving evidence that suggests that this is not just a UK phenomenon. This is an international phenomenon. But we've got good quality data from the UK.
So it's happening all around the world. More people are dying in every country and every neighborhood than they normally would have before COVID. What changed? Well, let's look.
Where I want to look. So that's what this is about. We'll be giving some reasons why this might be happening. And we'll be trying to think a little bit about what we need to do about it as well. But it is definitely happening. There's been anecdotal reports about footballers and things having heart attacks. But this is definite statistical data now. So we can be sure about this evidence that we're about to give.
So he's talking about, we've all seen the videos of soccer players just collapsing with heart attacks. And apparently we never saw that before. I never saw people talk about that before.
I've never even heard of that before.
I never ever heard of that before. Well, I did. There was that Hank Gathers, who was a top draft for the Boston Celtics. He had a heart attack playing basketball, but they blamed that
basketball.
They blame that on cocaine. But
how could soccer get you that excited that you have a heart attack? It's not with basketball. Yeah.
I'm not sure if that was his name, Hank Gathers. I could be wrong.
No, it was Len
Bias. It was Len Bias, not Hank Gathers. That's a different guy. Len Bias. That's who it was. Thanks. Yeah.
So hundreds more people are dying per week in England and Wales than usual, and it's not from COVID. Office for National Statistics. COVID deaths for the UK. Week of the 24th of June ending, 346 people died from COVID. Not all of those from COVID. Some of those were with COVID. 17th of June, it was 309. But the total deaths registered in the UK were 12,278. But this is the key thing. This is nearly 16% above the 5-year average.
So they take an average every 5 years of they take the number of how many people are dying on average each year. And this year we have almost 16% more people are dying on average in the UK.
So way more people are dying than we would expect based on the previous 5 years. Way more than we would expect. What is going on here?
Well, the conspiracy theorists say it's from the... And let's see, is it?
If more people are dying, this is quite a big concern. 16%, 15.9% more people than we would expect this week, this time of year, based on previous years, not COVID related. Latest breakdown for England and Wales that we have here. So the excess deaths more than we would expect, 1,540. COVID deaths, 285. About 6% of the COVID deaths gave COVID as the underlying cause. So 166 were from COVID and 119 were with COVID. So basically of this 285, quite a lot of those were basically incidental recordings on the death certificate. So if we take non-COVID excess deaths at 1,540, take away the COVID deaths, that means that the excess deaths that are not due to COVID are 1,374. So these are excess deaths that are not due to COVID. This is too many to be a statistical artifact. This is a genuine effect. Let's just look at a couple of graphics. So here we see the excess deaths. The black line there, the black marks there are what we would expect. Of course, this is going to vary depending on the time of year. But obviously, we see in the COVID spikes way more deaths due to COVID as we would expect. The dark blue are the deaths due to COVID. But now we actually see that the deaths are above the 5-year average, but not attributable to COVID. Here's a bit of a blow up of that. So COVID are the deaths there in blue, all the non-COVID deaths are in green, and we see that these are above the 5-year average. and only a small proportion of those are due to COVID. Only the blue bit is due to COVID. This one here, where the deaths appear to be below the 5-year average, it was a bank holiday in England and Wales, which in the UK are unfortunately, depending on your perspective, taken quite seriously. So England and Wales data. This is England and Wales data. This is the 5 years up to 2019. So the ONS is quite clever here, really. So it's given this figure of excess deaths here. That one, the 15.9% excess deaths. That's based on the previous 5 years, but of course the previous 5 years included 2020 and 2021.
So he's saying that statistic he just showed you that said 16% of higher death rate. He said that's based on the previous 5 years, but that includes the COVID years, which is not a good representation of an average year. And so he's saying now they actually did a study where they took the 5 years before COVID, and now he's going to show you that.
We had a lot of COVID deaths, of course. So these statistics take into account the period of 5 years before that, up to 2019. So they don't include COVID deaths. So we see that here, the deaths are even higher. So 16.6% excess deaths in England and Wales over pre-COVID times, and 18.2 if you just take Wales on its own. So very much higher in Wales.
That's a lot more deaths. That's almost 20% more deaths a year. That's a lot of deaths.
Maybe it's because they're not wearing masks. Did you think of that?
Could be.
So we've got this excess of deaths that is not attributable to COVID. Why are these people dying at a higher rate? Now, first thing to look at is where the deaths are occurring. Now, most of them are occurring at home. So 31.5 of these above the 5 year, 31.5% above the 5 year average, simply people dying at home. Hospitals 12.1%, other care homes 10.3% above that. Now,
does this 30% of people more dying at home, does that include suicides? I bet suicides are up. I'm just betting.
5 year averages, other settings, business, etc., 10.1%. So we see, especially at home, a lot more people are dying in all of these situations than we would expect. And most of this is not attributable to COVID. So what is going on? Well, some experts have put together a few ideas, and I've added these with a few of my own. So quite a few health experts are calling for an urgent investigation, which of course I would call for that as well. We need to find out what's going on here. Pandemic response is probably part of the reason. The effects that we took to control the pandemic in themselves would have caused some.
So he's talking about the lockdowns. So when you do lockdown stuff to try to deal with COVID, that also contributes to more deaths. He'll explain it.
Excess deaths, there's no question about that. Ironic, but probably going to be ongoing for some time, and we'll look at some examples of that now. So stress is certainly a factor. Human beings relieve their stress quite often. If I'm stressed, I'll try and go for a walk with one of my mates or something like that. Or, human beings reduce their stress a lot by talking to each other and by touching each other. And of course, that wasn't possible for periods of time. This can have knock-on effects, that is for sure. Reduce physical activity, I'm not so sure about that. During the first and second proper lockdown periods, I saw more people walking outside my house than I've seen for years.
Now, here's where I get to be smarter than him. So he's saying he doesn't think that people had reduced physical activity due to the lockdowns, which is pretty dumb. Because his anecdotal evidence is he saw people walking on the streets outside of his window during the lockdowns. That's his evidence. That's his big evidence, which is not evidence. That's just an anecdotal story. And they closed gyms. They I saw the government workers with tractors at the beach putting sand in skateboard parks. Like they got 60,000 homeless people, but man, they were on it that they can't solve they can't fill a pothole, but they can put sand in a skateboard park like that.
They got to salt the earth.
It's so he's wrong about that. There was reduced physical activity a lot. Okay.
So, in family groups, which we're allowed to do, household groups. So is that true? I don't think we've got any firm data on that, but it's a possibility. Lack of access to healthcare is probably the biggest one. There's going to be an excess deaths, particularly of cancers and other conditions. That is definitely a big factor.
Because during COVID, people couldn't go to the doctor and they didn't get stuff diagnosed. Like a lot of cancers went undiagnosed until they were in later stages. I know
that's
that for
a country
a fact.
With a healthcare program.
Yeah, and that's a country that actually has universal health care.
Yeah.
People were unable to access healthcare for fear or for whatever reason it was. People didn't access healthcare as they normally would. Therefore, diagnoses were delayed and treatments are delayed. And that's going to have, especially if you think something like cancer, that's certainly going to have a significant effect in increasing deaths. Delayed referrals for diagnosis and treatment, both of those. Still a big waiting list at the moment. Specialists are very concerned, rightly, about getting the waiting list down. But of course, more people are coming in all the time, which is a problem.
I had to go see a neurologist. Is that what they're called? I had to go because I had occipital neuralgia is what it's called. That was one of the side effects I got. And I had to go to a what do you call a neurologist? Do you know how long I had to wait to see a neurologist, just to see him? I waited like 2 months.
That sounds like Canadian
I'm like,
crappy social.
I thought this is how the kind
socialist healthcare.
Yeah, isn't this the socialist healthcare you get in Russia? I thought, what?
Yeah, right.
And and it had nothing to do with money. They weren't like, well, if you pay more money, you can come in. There was nothing. No, that's it. No matter what, you can't see a doctor. And it wasn't just that one. There weren't any neurologists available. That was the one I could get in with the earliest. And by the way, that guy sucked. That guy was horrible. He told me to get my booster. That's what he told me.
No.
He told me to make sure you get your booster. He goes, you didn't get injured from the vaccine. Take your booster. Okay, go ahead. What are you going to say, Kurt?
I think all the people didn't get like their meds that they need.
Yeah.
With suicides and stuff like that. And then people that took too much of meds that they probably shouldn't have taken because of the depression of being locked down. And, a lot of drug use went way up.
Yeah. Oh, I started drinking more.
Yeah.
And my doctor told me everybody's drinking more. I did. I started having 2 cocktails a night with dinner. I never did that stuff before. I never had a cocktail every time I ate. But I started. Okay.
We are well behind. Treatments that should be getting given now are not being given now, and this is causing some deaths. Cost of living crisis is definitely there. Now, I'm not an economist, but clearly the factors, all of the lockdown costs, the COVID costs are massive. Government spending was, some might say, injudicious. Then we've got the effects of the tragic war going on in Eastern Europe, the Ukraine situation. All of these things are contributing to real increase in cost of living, causing stress, dietary change, and difficulties. Now, another thing I thought about particularly...
So that's what they're guessing is causing the excess deaths. Okay.
It was the effects of COVID itself. People whose health is weakened by COVID. Now, we know there's a big long COVID problem. Is that leading to a certain...
So now he's saying that, well, a lot of people got COVID, and then COVID makes you more susceptible to have health problems like strokes, heart attacks, autoimmune disease.
Amount of deaths, it's hard to tell. Could COVID be affecting the immune system? Could it be causing other longer-term diseases? Possibly. More data needs to come out on that. For example, after COVID, we know there's an increased risk of stroke. We know there's an increased risk of heart attacks and probably other diseases as well. Has vaccination been causing an increase in deaths? We know vaccination has caused some deaths. Clearly, we know that. We know people have died after vaccination, COVID vaccination. We know that. Is there an ongoing effect here? Is there an effect on the immune system?
So isn't it something he just kind of says that nonchalantly, that we know people have died from the vaccine? We know that, he said.
Well, did he add the valuable context that you should still get it because it's better than not getting it?
Yeah, you should still get it.
Less.
You'll die less.
Important context.
He should give that context.
Of don't worry about it.
Yeah. Like that's an amazing thing I think he just said.
Me too.
That should be earth-shattering. But it's not. Because the corporate media, which is owned by Big Pharma, chooses what to make earth-shattering and what not to make earth-shattering. Right now, they're making BA.5, the Omicron variant, they're trying to make that earth-shattering. Even though it's not. And he's saying that almost under his breath. That's a big deal. How can you have mandates with what he just said?
To tell you the truth, we don't have too much data to go on that. Governments haven't released much data on that. So it's certainly a possibility. Certainly a possibility that vaccination is causing some increased deaths. We know there's increased autoimmune diseases. Is this due to vaccination? Is it due to people who've had COVID? Both affecting the immune system, of course, probably partly. But there again, we know that autoimmune diseases have been increasing in the years prior to the pandemic. The degree to which they've been accelerated by the pandemic, we don't really know yet. More to come on that. We need to find these things out. New medications used as COVID treatments. Now, I'm not going to mention particular treatments, but you and I know that pharmaceutical companies have produced new treatments that they put forward.
So now I was given, when I got Omicron, I was prescribed Paxlovid. And one of the side effects is that you're going to get COVID right away again. And they don't tell you that. And I got COVID right away again. Fauci, same thing. Fauci got Omicron. He took Paxlovid. He got better. He got COVID right away again. There we go.
As antivirals, and these have been given to people. They haven't been used for very long, so we don't know what the long-term effects of these are. By definition, we don't know what the long-term effects are because we haven't had a long time yet to find out what the long-term effects are. I'm not too concerned about, the same applies for vaccines, of course. I'm not too concerned about the repurposed drugs, such as the antibiotics, such as the steroids that are used quite extensively in severe COVID, because we are very good at using steroids. We know very precisely the different steroids to use. We know very precisely the doses, and we know very precisely the adverse effects, because we've been using them for, well, certainly all of my career. But we've been using them since I've been using them since the 70s. So they've probably been used. They were well established when I started as well. So we've been using these for decades. We know about these drugs. The same with the anticoagulants. We know about those as well. And okay, there are side effects, but we know about these and we can account for them. So I don't think that's it. But I think there is a question mark over the newer treatments. Now, just before we look at what the great and the good have to say about this, I just want to show you a couple of interesting slides here. This is the first one. This is the total number of deaths. We see this was the peak in
Okay, I don't care about this part. Now let's go to the end. Here we go.
This Professor Paul Hunter, who we've talked to on this channel. I think the reality is going to be quite complex, but it's something we need to be aware of and actually try and understand. We need to try and work out what's going on here. So he says there's despair from losing your livelihood. If that's gone down the Swanee, that's not good, of course. But there's other factors as well. It doesn't have to lead to suicide. Chronic stress can lead to all sorts of problems.
So what does this mean? He says, there is despair from your livelihood disappearing up the Swanee. I guess that's the Swanee River. Okay.
I don't know what that means.
So, like, there's a saying that, up the river.
Your livelihood's gone.
Yeah, so that's the Swanee River without a paddle, that kind of a thing. So you're screwed. You're going to have despair if your livelihood got crushed by COVID. That's what. So this guy's trying to figure out what happened. That's what he's saying. This doctor, and here he goes.
So Professor Hunter, looking at the socioeconomic factors there, he does look at other factors as well, of course. That's just an example. Dr. Charles Leveson, Dr. Call, GP firm of some sort, I'm not quite sure what it is, a GP company, I think. The reasons behind these horrific numbers are complicated and none of us fully understand them. True. So, that is exactly why there should be an urgent comprehensive government inquiry. Couldn't agree more about that. If we don't know, let's find the heck out. If anything, the situation seems to be getting worse. Death rates seem to be increasing, not due to COVID. Considering the relentless focus on one virus over more than 2 years, so government policy has basically focused on coronavirus over the last 2 and a bit years. And let's be quite honest about this, at the expense of many other diseases. Because when we had the pandemic, other diseases didn't go away. And the government has over-focused, it would now appear, have over-focused on coronavirus. Requesting answers from government on thousands and thousands of non-COVID excess deaths is entirely reasonable, absolutely. If there's thousands and thousands of excess deaths that are not attributable to COVID, we should know why. If you want a bit more on mortality figures, that is an excellent guide there from the Office for National Statistics. Feel free to check that out. So there we go. There's an excess in deaths in the UK, for sure. Other countries, very probably. We don't know why it is, but we need to find out. And on that question mark, I think that's about what we've got to say at the moment. We will be following this, of course.
So there you go. So I think there's a lot of things contributing to the excess death, and including the. And I wonder if they'll ever be able to figure out how many excess deaths are coming from each category. You know, is it coming from lack of exercise, lack of diagnosis of illness? Is it coming from the, like, that's what I really want to know. How many deaths are being caused directly attributed to the, but he also said that you can't get that kind of info on that stuff. So
it's weird that you can't. It's weird that you can't get all the info on it.
Hey,
that's a strange thing.
Kurt, have you ever been able to get what the actual death rate is from COVID? Because they kept reporting COVID deaths with COVID, which is a lot different than death from COVID.
Yeah, right.
And so I've heard, you know, at first that they were saying 3% death rate, but they were saying that in March of like 2020, and I don't think anybody has updated it. That's the hardest thing, is to try to find out what the actual COVID. Now we know the Pew Research, they did a study and they said that the hospitalization rate for COVID was 0.89%. That's what they said.
But that's still 20 times higher than if you.
So
20 times.
Last time
times 20.
Last time I checked, 0.89% was less than 1%.
Yeah, right.
That's and 77% of the hospitalized people for COVID were obese or overweight. And remember what Bill Gates said. I don't even want to say it. Okay, so there you go. I wonder where the excess deaths are coming from. I know it can't be because I was told
give that to toddlers. It's that safe.
Yeah, you give it to toddlers now. I was told that I was told by every comedian friend of mine that it's fantastic and that I'm a jerk for doubting big pharma and the corrupt government.
Except for a couple that just dropped dead suddenly. Or just dropped on stage.
Here we're going to Sacramento, back here in Los Angeles, Bakersfield, Indianapolis, Louisville, Cincinnati, Tulsa, Oklahoma City. Go to JimmyDoreComedy.com for a link for all the tickets for all our shows.